Good afternoon. At this time, I'd like to welcome all of you to today's seminar on grief and bereavement, hosted by Rutgers Institute for Health and Rutgers Graduate School of Applied and Professional Psychology, along with our community partners, Trenton Health Team, New Brunswick Tomorrow, Robert Wood Johnson Community Health, and the Center for Asian Health. We'd like to welcome all of you to today's seminar. It's the third in our series. As a reminder, we'd like to ask everyone mute their phones at this time. For those of you joining us by phone, you can hit star followed by the number 6 to mute and unmute your phone. At the end of the lecture, we will have time for Q&A as we've done the first 2 weeks, and we will review how to ask questions and mute and unmute yourself at that time for the Q&A. As before, the lecture portion of this presentation will be recorded and it will be uploaded to the Institute for Health's YouTube channel. We will provide a link to that YouTube video along with the handouts mentioned in today's seminar to you on Monday. So again, on behalf of the Institute for Health, I'd like to welcome you all to today's seminar, and I'd like to introduce today's speaker with the Graduate School of Applied Professional Psychology, Mr. Drew Mendelson. Drew, we'd like to turn it over to you.
Hi, thank you so much. And thank you for coming to our presentation today. My name is Drew Mendelson, and I'm with the New Jersey Hope and Healing team. And today I want to talk to you about grief and bereavement during the COVID-19 pandemic. So before we begin, I want to encourage you all to reflect on 2 important questions that many people have been grappling with during this pandemic time. So first, what are some of the things you have lost during the pandemic? It could be as simple as missing eating out or maybe missing a special someone. And second, how would you help yourself or someone else if they were grieving during the COVID-19 pandemic? So I'll give you all some time to think to yourselves about these questions before we begin. Take a moment just to yourself to pause and reflect and just think to yourself. Okay. So you might be wondering, what exactly is grief? So grief is a natural and necessary reaction to a significant change or loss. So whatever our experience, understanding grief can help us face the reality of a loss, deal with difficult feelings and thoughts, adjust to a new life, recover, and even grow. So one of the things that can seem overwhelming about grief is that it can affect every aspect of our lives. The reactions can come in tidal waves, leaving us feeling totally out of control, or they can hit us slowly, or after we think we're over a loss. No 2 people are going to experience grief in exactly the same way. The intensity and extent of our grief will depend on our relationship with what we've lost. So when we're grieving the death of a loved one, our grief will be as unique as that relationship that we had with them. It could be influenced by situations surrounding the loss, the social support we have, our cultural heritage, and our beliefs. There are, however, certain experiences that most grieving people share. And this is what we call the grief process. It's a process because it unfolds over time. So our thoughts and feelings may vary from day to day or even from hour to hour. And as we know, the only way to get through grief is to be able and go through this process. So our first reaction is often denial. We say things like, it can't be, there must be some mistake. Disbelief and a sense of numbness provide a buffer against a feeling a loss all at once. And it may be hard to think clearly or make decisions. Tears may flow and we might experience nausea, headaches, insomnia, or lack of appetite. And this may last from a few hours to a few weeks. The stage of denial gives way to emotions as we begin to move toward accepting the despair of a loss. So some of the most common reactions can include anger, like we might feel resentful of others or angry with ourselves for not being able to prevent the loss. And our anger might be directed at those around us, the person who passed away, or even just at the world in general. Also guilt. So thinking of things that we wish we had done differently may lead to guilt. Fear and anxiety. So loss means that whatever happens next, life will never be the same as before. And it's very normal to worry about the unknown that's to come because it takes time to create a new path in life. And sadness. So feeling exhausted and struggling through the return to a routine is very normal for a while. So we might feel a sense of emptiness and a lack of interest in the things we once enjoyed. It can be hard to concentrate, and it might be really difficult to think about the future. We might over or undereat or over or undersleep. And finally, there's searching. So a lot of mental energy might be consumed trying to understand why a loss has happened. So like why or why now? And as a human, we have a deep need to understand loss in the larger context of life and our belief system. So this is all part of the process of finding eventual peace within ourselves. And many other emotions may emerge during this time as well. So we may have trouble feeling motivated to complete tasks, or we might feel restless. We might feel like the rug's been pulled out from under us, like we don't know where we fit in anymore. We might even question who we are now. This period of despair usually lasts from a few weeks to many months as we work to experience the pain of the loss and come to terms with what meaning it has in our lives. So the next stage is release. And during this time, the pain of the loss begins to lessen and the good days outnumber the difficult ones. The period of release is about letting go, regaining emotional energy, finding forgiveness, and saying goodbye. All those things that bring closure to a relationship. We start to be able to imagine a future for ourselves without the presence of the thing that we've lost or the person that we've lost. So this isn't easy for most of us and may come and go over time as we work to adjust to the changes in our lives. There might be times where we begin to enjoy things again, but feel guilty about it. And this is a very common experience, but in time, we begin to see that we can heal without forgetting. The last part of the grief process is what we might call renewal. So you may have heard people talk about putting their lives back together. Finding a new normal means being able to identify the new me. It's about accepting that we'll never be exactly the same, but that we are okay and might even be stronger in some ways. Realize that we can feel okay about feeling good again and can look forward to what life has to offer. The task of renewal is to accept that the loss will always be a part of who we are and find its rightful place as we move forward with our lives. So, as we've talked about, grief is a natural feeling accompanying any kind of loss. So typically, grief is associated with losing a loved one to death. With COVID-19, people are also experiencing grief related to the loss of routines, livelihoods, and relationships, among other things. So it's perfectly normal to grieve when you have to put your dreams on hold as the world shuts down. It's also normal to grieve when you can't celebrate your child's birthday, your friend's graduation, your honeymoon, or other important life events. A lot of us are grieving not being able to get together with family and friends in the same ways we used to. Many people have lost employment and are having a difficult time dealing with the loss of the stability they once had. And so while it's always good advice to be thankful for what we have, it's also important not to minimize the pandemic or any of its associated losses. Also challenging is that we don't know how long we'll be impacted by COVID-19. So with no clear end in sight, feelings of grief can intensify and make people feel even less in control. So going through grief is not only normal, but also expected during this time. It's important to know that we all grieve differently. So some people might experience feelings more intensely than other people. In the current environment, any losses experienced now have additional layers of complexity and depth. Likewise, if we've had previous traumas from earlier stages of our lives, the stress of the pandemic might bring up past life experiences that were painful for us. It's important to be sensitive to these potential triggers that we have. There's nothing wrong with having emotions that are hard to deal with during this time. And I can't say it enough, it's a very common response to loss. And when we don't express our feelings, they can get stuck in our bodies, causing physical illness and depression. So this is important to keep in mind when we're finding ways to help ourselves and support our loved ones during this very difficult time. So how can we help ourselves during this time? Well, number one, it's important to recognize that healing takes time. So it helps to have practical tactics to use in your daily life, strategies to address emotional needs, and ways of getting support. So here are some suggestions. One, maintain it as normal a schedule as possible. Maintaining as normal a life as possible is important when we're dealing with so much uncertainty right now. In the first few days after a loss, alternate periods of exercise with rest and relaxation. It's important to treat our bodies with the same respect and honor our bodies in the way that we have previously, even when it's hard to do that sometimes. It's important to both stay active and engage and give yourself permission to heal and recover. Structure your time, keep busy, and make sure to wait until you feel better to make any life changes. You don't want to make any big decisions while you're still working through some difficult feelings. Do, however, make as many easy daily decisions as possible. That can give you a feeling of control over your life. Eat well-balanced and regular meals, even if you don't feel like it. We know that what you put in your body affects your mind. Avoid trying to numb the pain with drugs or alcohol. It's going to be important to face the pain head on if there's hope for healing, as hard as that is. Keep a journal. Writing down feelings can be therapeutic. Or you can reach out and talk to people by phone or video chat. Connecting with others can really help, especially during a time of loss. So give yourself permission to feel sad and share your feelings with others. And if you have recurring thoughts, dreams, or flashbacks, those are normal. You don't want to try and fight them. They will hopefully decrease over time and eventually become less painful. So make sure to accept your reactions, but don't be afraid to reach out for professional help if disturbing feelings persist. Many therapists offer televideo and phone counseling during this time. So what if a friend, a coworker, or a family member is struggling? How can you best support them? So do offer help and a listening ear even when they haven't asked. However, only offer a listening ear when you feel capable and ready to help. A good rule to follow is to listen 80% of the time and then talk the other 20%. Your presence can be comforting to a loved one, and you don't have to do or say anything special. Often, grieving people just don't want to be alone. You can tell the person you're sorry such an event has happened and you want to understand and help. Many times, the grieving person doesn't want to be a burden to others by asking for help. And so offering your help can take that burden off of them. So you can also offer to help in specific ways by bringing over dinner, shopping, gardening, etc. Grieving can make the demands of daily living feel very overwhelming. And during the quarantine, there might be a limit to what you can physically do to help, but you can still take on the task for the individual to relieve some of their burdens. As for what to avoid, it's not helpful to give advice unless asked. Everyone's grieving process is uniquely their own. So try not to minimize the loss or say it could have been worse or there's a reason everything happens. These cliches can make people feel like you don't understand the depth of what they're experiencing. And when people are in profound emotional pain, they can cycle through a whole range of feelings, including irritability and anger. If a grieving person snaps at you or doesn't feel like engaging, try not to take it personally. It's not about you. Coping with grief is hard on everybody. And so to pass judgment on how well someone's coping doesn't do you or the person that's grieving any favors. So all of this is easier said than done, right? Like, we know it's a lot of work for you to grieve and mourn. You might feel fatigued, and the reasoning and thinking abilities can be impaired as well. So respect your body's way of telling you to slow down and rest. Grief can be hard on your mind and your body, and we know that our mind and our bodies are connected. So take time to care for and nurture yourself. Facing loss during COVID-19 will affect your thoughts and feelings. The number of emotions that one might experience can be really confusing. So some of the emotions you might feel include guilt, relief, anger, and frustration. Sometimes these judgments or sometimes these emotions come quickly and last for short periods of time. Other times, several emotions follow one right after the other and last for longer periods of time. So these emotions are all normal and healthy across the spectrum. Allow yourself to learn from these experiences and emotions. And often people will unexpectedly experience emotions that appear to really come out of the blue and out of nowhere. So don't panic and don't be surprised when this happens. Remember that emotions are natural, and talking about them doesn't mean that you're crazy. Be sure to talk to people who will listen and not judge. These are the people who will walk beside you in your journey. And sometimes when people are in the midst of loss, they have deep moments of gratitude for what they once had and have today. So practicing gratitude trains our minds to change our thinking and to see the glass as half full. Working through grief and sorting through intense emotions can help you to learn new things about yourself and discover new strength that can result in emotional growth and maturity. And so in this way, loss sometimes yields gifts. So here are some resources we've compiled that you can use if you or someone you know is grieving the loss of a loved one. So Good Grief offers free guided peer support groups for recent family member loss, serving parents who have lost children or a spouse. You can email Anita at good-grief.org if interested. Rainbows also offers free support groups specifically focused on grief, anxiety, coping, and emotional well-being. These are usually geared towards children, but I know some sites offer groups for parents and caregivers under what's called PRISM. So you can use the Find a Group feature on www.rainbows.org and plug in your address to see groups in your area. And then you can contact those sites directly or email at info@rainbows.org. And Haven Hospice offers a virtual group on Wednesdays from 10 to 11 a.m. So to get more information from them, you can call 732-202-8071. And you can also reach out to us. So our organization is New Jersey Hope and Healing Program. So we provide short-term crisis counseling, emotional support, informational webinars, and referrals to additional resources. And so you can visit our website at https://gazap.rutgers.edu/centers-clinical-services/ccp.fema. I was able to pronounce it correctly before. SAMHSA. I'm sure one of my counselors can pronounce it better than I can. But you can go to that site to learn more about our services. And so here are the references for all the materials presented today. If you want to check those out. And thank you for being here for our presentation. So we're going to stop the recording now and take any comments, questions, thoughts, reflections